Good afternoon, everyone. In fetal medicine, the topic which we have chosen today is diagnostic fetal intervention. And specifically in this talk, what we are going to cover is we are going to discuss what interventions you do in fetal medicine for making your diagnosis. Okay, one second, my slide is not moving. Yeah. So today, first and the most important thing which you need to understand, what are the indications where you need to do an intervention? What are the various modalities which you can offer to the patient depending on the disease which you are suspecting? Then, like any procedure, like if you are going for a LSCS or if you are going for any hysterectomies or whatever, you do explain the patient. No, you tell the patient, yeah, this is the thing which we are going to do. These are the things which we need. For example, before a cesarean, you need a CBC, blood group, viral marker. They are basic set of tests which you do. Similarly, before offering any fetal intervention, you need to do a pre-procedure counseling, and you have a checklist which is what is DFI, Diagnostic Fetal Intervention. Basically, this means that you are doing some invasive procedure on the fetus so that you get a sample. A sample can be anything. It could be blood, it could be amniotic fluid, it could be placental villi, anything. And when you get that sample, what you do, you subject it to various modalities of tests as per your requirement. For example, if you have suspected a high risk for aneuploidy, you are going to do genetic evaluation. When do you offer these diagnostic fetal intervention? There should be some markers. No, how will you know this patient needs and this patient doesn't need that? See, it could come from the history of the patient. It could come from the family history. The reason may come from your screening protocols which you have employed in that patient. For example, you did a NIPT, it came out positive. You did a combined screening, that came out positive. Your ultrasound is showing markers, be it soft markers or major malformations, you will do it. If lastly, we may have to do intrauterine transfusion in the cardia of the baby. That has highest chance of fetal losses. So this is how we enter the, watch this, see through the placenta they went, and now here, you have entered the umbilical vein, that's all. Now you will take the sample, you will do whatever you want to, you can do it from. Now, what complications you can have, because here you're directly dealing with the fetal blood vessels.
Before a baby takes the first breath. This is diagnostic fetal intervention. Some fetal conditions cannot wait. Early diagnosis changes outcomes. Early detection truly means better survival. Advanced procedures like amniocentesis are critical for modern fetal medicine. Fetal blood sampling and intrauterine transfusion, performed with precision and expertise, saving 2 lives at once. Train in diagnostic fetal intervention today.
Now, how to insert the needle? 2 centimeter lateral. Always look at the probe. Don't look at the screen. You don't have to look at the screen. Look at the mother's abdomen. You have decided everything, which is the point where you want to enter. At that particular point, put your probe, needle 2 centimeter lateral to that. Insert the needle. It should not be like hesitating movement. It should be one single prick straight. You should go down. And always you have to keep the needle in the vision. What I prefer is doing in plane. If the needle is not in alignment with the ultrasound, you will not see the ultrasound. You will not see the needle. Okay. So many times the needle is lost. You insert it, now you don't know where the needle is. Please stop moving the needle. There's a baby inside. You may cause harm to the baby, and many a time baby will also go and hold it. Whether you want it or not, baby may go and hold it. So we don't want to injure the baby. Just stop there only. Move your probe and try to bring the needle in the focus vesicosynthesis. Before you do that, you should know that ultrasound is mandatory. You should have your genetic evaluation also done at that moment. Like if the luto is due to some genetic cause, single gene disorders, then you cannot do this. Doing this is a waste. You are going to have other complications which will come in as the baby grows. So then you should not do this. Always avoid procedures if there is already infection, the mother is already having infection in placenta previa and all these conditions.
Fetal intervention. Precision saves 2 lives. Not every case needs intervention. Confirm diagnosis and assess risk-benefit carefully. Informed consent is mandatory, ethically and legally. Always maintain strict aseptic precautions throughout the procedure. Monitor fetal heart and maternal vitals continuously. Be prepared for preterm labor. Always involve a specialized team. Emergency delivery setup must be ready. Skill matters. Judgment matters more. Bye.